Hey y'all, this is Sarah, and I'm just going to be showing how to create some patient lists to help nurses and respiratory therapists and whoever else wants to follow patients that they may have taken care of who were either COVID positive, COVID negative, but you feel may end up being positive, and COVID rule outs. So first thing you want to do is go to the patient list tab up here, and you would select that, and then you would click on edit list here and create my list. So you can create as many lists as you want. This particular one we're going to call COVID positive. And as far as available columns, you do need to put some columns in so you have stuff in the actual list. So I'm going to put name. You could put patient name and isolation might be another one that would be helpful. And then you could either also put admission date. Anyway, there are so many columns that are available, so any of those can be added here. You want to have the first one though be the way you want to organize these, so that's usually why I put patient name first. So anyway, as those of you who use patient list know, you can add a lot of different things here. I don't know if there is a COVID column yet. There may be by the time this goes up, but I am in the beta version, and currently the beta version doesn't have that column, but isolation may help. So I'm going to accept this. And now this is my COVID positive list, which I don't have any patients in there currently. I'm just going to do one more. So again, create my list, and I'm going to call this COVID rule out. And again, I'll put patient name. That. And isolation. And then admission. And like I said, there's a lot of these columns you can put in whatever you desire, but I'm just putting these three for the example. So I'm going to hit accept here. So now you have the COVID positive and the COVID rule out columns. So now we got to add patients to here. So down here under available lists, you're going to want to scroll down to whatever campus you work at. So I'll select First Hill, just because I know there are currently a lot of units at First Hill with fake patients on them. So I am going to, let's go to 8 East Medical ICU. Let's see what patients are there. So these are some patients. And you can take the patient and then add it, say Grumpy Dwarf here is one you know is COVID positive. So you could add Grumpy Dwarf there, and that would allow you to follow. He's going to stay in your list until you take him out. So again, you can follow, you can drag anyone over from a unit, and then you would have them there. One nice thing about lists is there are a whole bunch of different kind of short menus down here. Mine are a little more pregnancy related because that's my specialty. But you can select a lot of different options like these here. So lots of things. There's probably even one related to isolation. Oh, or here's infection summary. So infection status, all that. So that one actually would probably be pretty helpful. This infection summary inpatient one here, which you can see without opening the patient's chart. So anyway, and then you have the COVID rule out. So you do the same thing here. You would find the patient, and again, you can pull it from any unit, any hospital. So, and as long as you keep the patient here, it's always going to be there. No matter where the patient goes or if the patient's discharged, it's going to live in here until you move it around. Most of you who work in patient lists are probably aware of that. Anyway, hopefully this helps. And yeah, if you have any other questions, please let me know. Thanks.